Hi, everyone. Thanks for joining us today for our first webinar for the spring series. And it's on COVID-19, the impact on qualitative research, a blip in time. And our presenter is Dr. Silvana Di Gregorio, our research director here at QSR. So exciting to have Silvana present on the research she's been doing. Before we get started, just to go over some of the items with using GoToWebinar. So at any time, feel free to type in your questions in the question area. Also, we are recording this, so you'll get the recording a few days after the webinar. Also, I have a handout in the handout section. So those are the slides we're showing you today. So feel free to download those. And with that, and everyone's obviously on mute just so it's easier for you to hear us. But again, feel free to type in your questions. So my name's Stacy Penna. I'm the NVivo Community Director here at QSR International. I'll talk a little bit more about the community at the end. But it's been great that we've had this partnership with SAGE Publishing. So I want to introduce my colleague from SAGE Publishing. So go ahead, Ali.
Hi, Stacy. Thank you. And I and Sage have been really grateful to have this opportunity to partner up on this series as well. I am Ali Owen, and I'm the Research Methods Commissioning Editor. I work on the Research Methods book list, but I'm also part of a larger team within SAGE around research methods and innovation, which brings together journals and online courses and websites and blogs and anything you could think about surrounding research methods. So I think most people on this call are probably already very familiar with SAGE, but you can visit our website to find out more about our teams, products, and platforms, as well as get more access to resources around the pandemic and things like dismantling systemic racism and teaching, learning, and being well. But enough about me and SAGE. I am very pleased now to hand over to your presenter, Silvana.
Great. And our presenter, Silvana. I'll let Silvana introduce herself, and then I will make her presenter.
Right. Hi, I'm Silvana Di Gregorio, and as Stacy said, I'm Research Director of QSR International, the developers of NVivo. And I'm also a sociologist and qualitative researcher. And part of my job at QSR is to do research as well as to get insights about new developments in qualitative research that we can feed into the product team. I'm actually part of the product team with Stacy. So, right, if you can make me a presenter.
Yep, just
right.
send that over to you.
Okay, so if I just show my screen and just go to slideshow.
We can see it.
Great. Okay, so what I'm going to talk about is COVID-19, the impact of qualitative research, a blip in time. So I'm going to start by introducing the project and discuss why I decided to do this research. And then I will move on to the focus of this presentation, which is on the impact of COVID-19 on research, with an overview of the findings from both a survey I did and the follow-up interviews with some of those respondents. And then I would then like to open up the webinar to hear your experience of the impact of COVID-19 on your research. So while I'll be presenting it first, I hope to make it a little bit more interactive at the end so that you can sort of share your experiences. So the origins of this project was back in March 2020 at the start of the pandemic in the UK and the States. Stacy, my colleague, who as you know is the NVivo Community Director, and I were looking at how we could support researchers during this period. We decided to put on 4 webinars. I contacted Deborah Lupton, who had started a crowdsourced Google Doc on doing fieldwork during a pandemic. I also contacted Janet Salmons, SAGE Method Space Guru, who I knew had been using and teaching virtual methods in qualitative research for many years. Stacy felt we should also cover teaching qualitative research online, as by that time most universities had closed and academics had to move to online teaching. So we asked Christina Silver, Sarah Bullock, and Shireen Snelson to talk about their advice. And finally, we contacted Christine Hine, professor of sociology at the University of Surrey, to talk about doing ethnographic fieldwork online. QSR had never run such popular webinars. We were not expecting the over 5,000 registrants we had for each webinar. Our GoToWebinar platform could not handle the numbers, but all the webinars have subsequently put on the on-demand section of our website. So given this overwhelming interest, I wanted to know more about what conditions researchers were, whoops, too soon, what conditions researchers were facing and what they were doing about their research. So I developed a survey to find out about their home working setup during lockdown and how the crisis was impacting their research and university or organizations. So at the end of April, I contacted everyone who attended the webinars and who had agreed to be contacted by QSR. And in the end, 346 researchers filled out my survey. They were spread across the globe. 65 were from the UK, 56 were from the United States, 31 from Canada, and 26 from Australia. And as you can see, we had good representation from other parts of the world as well. So the majority of the researchers were from the academic sector, with doctoral students most represented, followed by early career researchers and established academics. There were a fair number of respondents from the not-for-profit research sector and a few from government. I'm going to start by looking at the impact of working from home. I was very aware of how fortunate I was to have my own home office. So one of the first things I wanted to find out was researchers' working conditions while in lockdown or under stay-at-home orders. The conditions under which we work has an impact on not only how efficient we are, but on our mental health. This was an open-ended question as I wanted to get a flavor of what it was like for everyone. These photos illustrate a range of home working situations experienced by researchers. Just over 40% had a productive workspace at home. Most of these researchers already had a home office. The key comment here is, I have the space and technology available to do research writing. Some people found they had more time to devote to research. Nearly a quarter of researchers had an inadequate home workspace. Many do not have a desk and have to work off the dinner table, if they are lucky. Others have to work on the couch or bed. Those with small flats that they are sharing found it difficult to get privacy when conducting interviews over the phone or online. 20% mentioned that they were struggling with juggling with the needs of their children and work. Children needed help with homeschooling. Younger children found it difficult to understand why their parents could not play with them. Some parents resorted to working late at night or very early in the morning. When two parents were working, many had to resort to a rota system, taking turns over when they would work and when they would parent. So working at home impacted researchers in very different ways. For some, they actually could get on with more research, not having to deal with meetings or administrative duties or commuting time. For others, there were major issues with finding somewhere in their home where they could concentrate on their research. I will now look more closely at how the pandemic impacted research. The vast majority of researchers were planning to use data collection methods that required face-to-face contact with respondents, with about 85% planning to use face-to-face interviews, 55% planning focus groups, and 40% planning participant observation. Just under 30% were intending to use online data collection before the pandemic. So you can see that, if you look at, all the things, is that it's really, everyone was going to be doing in-person research. The vast majority were. So not surprisingly, nearly 80% of the researchers said that they were considering changing their research. Just under 2/5 were considering changing to online data collection, while others were planning to either postpone their research or extend their deadline. Some researchers felt they needed to change their research questions and design. So before I move on, I'd like to run a quick poll on whether you had to change your research in any way during the pandemic. So Stacy, if you could run the poll.
Yep, everyone should see it now. Just give people a little time to do it.
So it's just a simple yes or no in any way.
Yeah, and it's so right now it looks like with the 73 or 75% of people voting, we have 78% said yes and 22% said no.
Right. So 78% did of the 75 who
Yeah, and now we're
responded.
at 78. Yep, it's keeping steady at 78 and 22.
Right. Can we see that?
So I'm not sure I can see it as an organizer. I'm sorry, I'm not that good at the polls to know how to.
Okay. Well, we'll take your word for it, Stacy.
Yeah, I wouldn't lie to you.
No. Right.
Okay, I'm going
So,
to close it now so people can see your PowerPoint.
right. So yeah, so I mean, so that's sort of similar. I mean, yeah, as I said, here it was 79.6%. Yeah, 70. So that seems to be accurate. It's nice to get that kind of feedback. Right. So back to the survey I did at the end of April 2020. Nearly a quarter felt that the COVID-19 crisis had disrupted their whole study. Their study was on hold either because it was not possible to do the kind of fieldwork that was required, or that it would not be appropriate to contact study participants under the circumstances. A few felt that their whole research topic had become obsolete. As you can see from the quotes here, I'll just move that back. So here was someone who was doing research with rural communities in sub-Saharan Africa. And you know, the main fieldwork was planned for April and October, and they had to stop everything as they weren't able to move around the countries. And yeah, they were facing the reality of having to request a significant costed extension from our funders, which they're not sure they would get, and are drastically reducing the whole scope of the project. You can see in the second quote there is that someone was planning on doing research with senior managers in the tourism sector. So we know that's been all pretty much dead, more or less. And yeah, they say the research is on indefinite pause, and yeah, and also waiting to see, you know, how many of those businesses actually survive. So that was, you know, a quarter. You know, we're disrupted in a major way. Right. Right. So nearly half mentioned that the crisis had a major impact on data collection. Many had to redesign their data collection, which then required a need to reapply for ethics. Others had to pivot from collecting data to focusing on theoretical work and desk analysis. So I just wonder how many of you found similar things. However, it wasn't all gloom. There were some silver linings. New lines of research and new opportunities opened up for a few. Others found they had more time to write. And several researchers commented that it was easier to recruit some hard to get populations as they spend more time online. So that's quite interesting. Moving on to their thoughts about looking ahead 6 months from then. So this is sort of 6 months from April. And from the perspective of late April, early May, nearly every researcher, regardless of where they were based, had a very pessimistic view of the situation in universities and for research in October. Face-to-face data collection would continue to be not possible with subsequent delays to research. Research funding would be problematic, although some researchers saw they could benefit from research funding shifting to COVID-19 issues. And many researchers were employed on fixed-term contracts, and they were uncertain whether these would be extended. Most thought there would be a decrease in the number of enrolled students as they were getting feedback that university students were not happy with online teaching. And with the predicted fall in international students, there would be less money for universities, which would lead to job losses and hire freezes. Another important concern was the impact the crisis would have on early career researchers who would miss out on opportunities to network and develop their research by attending and presenting at conferences. So it's important to remember that this was the perspective when the pandemic was at its, I have to say now, first peak in Europe and North America. So, so between the beginning of June to the beginning of July, I conducted some follow-up interviews of those who participated in the survey. 132 researchers out of the 346 surveyed agreed to be contacted for a follow-up interview. As I did not have the resources to follow up on all of them, I narrowed the candidates down to 3 disciplines: health, sociology, and education, and from a range of positions and whether they indicated that their home working conditions were productive or inadequate. I also wanted to get a range of countries. There were 25 potential interviewees whom I contacted. In total, I contacted 12 in-depth online video interviews. 1 was an established academic, 4 were early career academics, 4 were doctoral students, 2 were not-for-profit researchers, and 1 was a government researcher. Obviously, the first peak of the pandemic had passed in North America and Europe when I interviewed them, and their universities and organizations had a clearer idea about their plans for September, October, which is not necessarily what actually happened in September and October. But anyway, we'll get to their views here. So postgraduate students that I interviewed had very different experiences, from having lots of support from their university with weekly virtual meetings with supervisors and WhatsApp groups for postgrads to having very little support, little contact with supervisors who were not helpful with how to adapt their research. One of the PhD students who depends on her income from teaching and research sees an uncertain future because her contracts were all ending in October. One doctoral student from the UK commented how the pandemic shifted her view of herself as a PhD researcher. Before COVID-19, she felt she had to put on an act to appear, as she put it, as a grown-up researcher. But she found that there were many others struggling to pivot their research. She felt more relaxed and able to be herself, not only with the respondents of her study, but with her fellow doctoral students. Because basically they were all in the same boat, and they were actually helping each other with trying to find ways of pivoting research. Many of the researchers thought that as they have been forced to consider remote ways of collecting data and communicating, they are seeing online or remote research as becoming viable. Having to maintain personal and family relationships online during lockdown has made some researchers more confident of working professionally in this way. It also opens up new possibilities, such as doing international research or using social media as sources of data. Several researchers mentioned that collecting data remotely widened the number of people who they could recruit. There are vulnerable populations who may feel uncomfortable with a face-to-face interview and prefer a remote form of data collection, such as telephone interviews. In fact, many of the researchers in both the survey and the interviews mentioned they are using telephones. But there are a number of researchers who pointed out more negative side of online research. They point out that some people are less comfortable with technology, that others may not have access to computers or smartphones for Zoom interviews, for example, and also that participants may not be able to talk confidentially if they're answering questions at home where family members or others may overhear them. And also, people could be feeling zoomed out with so much going on with Zoom in terms of, sort of informally reaching out to friends and family. So, did the interviewees I talked to feel remote research as a blip in time? As I mentioned earlier, they were certainly a group who had never considered online or remote data collection methods and who, having been forced to consider using them, see many opportunities opening up, such as doing international research or using social media as data sources. And it also has the added benefit of saving money. However, some of them felt that senior academics would push to restore traditional ways of research, as they are not comfortable with remote or online research, and they're the ones who control grants and sit on boards. However, those who control grant funding may require more justifications for travel costs for international research, as this period has shown that it can be done remotely. Interestingly, a few people actually mentioned that the pandemic experience has highlighted the importance of face-to-face interaction. They see remote as a temporary solution, but feel that maybe the disdain that some people might have had before for online or remote research has gone. So more hybrid approaches combining face-to-face with online methods may be adopted in the future. Quite a few mentioned that it depended on the topic and the respondent group. So, for example, Zoom interviewing might work very well if you're interviewing professionals because they would be more likely to succeed as they already had the technology at home and are more likely to be used to working online. But many groups would be excluded as they do not have the technology or privacy at home. I just want to finish on a comment from the senior UK academic I interviewed. Um, she expressed concern for early career researchers. Um, she reflected on how her career developed by going to conferences and meeting and connecting with other researchers. She fears that this generation will not get those opportunities and that there will be many redundancies. So I don't know how many early career researchers are out there and whether you feel that you're missing out. So over to you. Whoops, I'll just stay here. So over to you. I'd like to now open up this discussion to hear about your experiences. But first, I'd like to answer another quick poll. So Stacy, if you could run the next poll.
Yep, and I think I figured out how to share it too after it closes. So yeah, just give people a minute to do it, the poll. Okay. All right, I'm going to close the poll now. So if anybody wants to get their last minute vote in, and then I will be able to share it. Can you see it? Savannah, can you see the poll?
Yes, I can see it's quite small.
Oh, it is? Oh,
Yeah,
weird.
on my screen.
It's big on my screen, maybe because I'm not sharing my screen, but okay, I'll just read what it says. So it says 18% same, 64% more, 19% less.
Right. So actually, you can share your screen now because I don't because I
Oh,
lost my
okay. Let me share my
image.
screen. Okay, hold on. Let me just
Yeah.
switch over. Oh, the poll went away. Okay.
Oh, I
I
can
can
see it.
actually see the poll,
Oh, now
and
you can. Oh,
it's
that's so
big.
funny.
Yeah.
Now it's big. Okay, that's why. Okay. Okay, great.
Right.
So, yep, so that's just what I read off. So, does that surprise you, Silvana?
Uh, um, yes and no. I wanted to ask the question because I wasn't sure from like the results. I mean, obviously we're further on since I did those interviews. So I did those interviews in June and July, and yeah, and I only had the in-depth interviews with 12 people. Um, but yeah, so it is interesting that over half think that more people will continue to use online methods. And as I said, I did have that comment that um, um, that some people might have thought of it with disdain, to use tech, um, but that when they, other people, saw that it's working for them,
Mhm.
so that they use it. And also the other thing is that, yeah, there were people who definitely hadn't ever considered online research, and for them it kind of opened up new possibilities. That it makes it easier to do international, interviews with people around different parts of the world, that sort of thing, as well as using social media as sources of data. Um, so I don't know if there's any questions out there.
There are a few. Um, so here's a question. How do I ensure the quality of my data is good? I have had to switch to telephone interviews with my previous plan of doing participant observations. How do I ensure I maintain the depth I need?
Oh, so it's sort of switching from participant observation to telephone interviews. Um, yeah, I mean that is a leap, um, in the sense that um, with participant observation, you're doing much more than just interviewing people or talking to them. Um, I mean, I think it sort of means, I guess, sort of revisiting your research questions in terms of what you can get out. Um, what's interesting is that a lot of people, both in the survey and quite a few of the 12 that I interviewed, had switched to telephone um, interviews. Um, and I mean, and the feedback that they got in depth was was that they they were able to actually get more. It kind of depended on the type of um, respondent you're looking at. But but for the respondents who were more comfortable with actually talking on the phone, they were able to get more depth than they thought if they were seeing them face to face. And also that there would be fewer. They thought they would have been able to recruit fewer people if it was face to face. So it's an interesting thing with telephone interviews. Some people actually feel more. It's more anonymous as it was, and that can work in a good way in terms of um, enabling people to talk more depth um, than they would do if it's face to face. But it's very dependent on the type of person you're talking to. So I don't know what your experience was. Um, um, I don't know who's asked that question, uh, but
It was Maryline, Marilyn.
yeah,
But
I mean,
I can, yeah.
can you make her unmute her? And
Oh yeah, if she wants to be
if you want
hold
to be
on.
unmuted.
If you raise your hand, then I'll know you want to be unmuted.
Yeah.
Sorry, I'm just getting turned. Oh, yep, she does. Okay, sorry, I can unmute you. Go ahead.
Hello,
Hi.
I believe you can hear me now.
Yes, we can hear you. Yes.
Perfect. So my name is Marilyn. I am a PhD student at University of Strathclyde. I'm doing a research that is based in Kenya. I'm looking at sort of like the informal sector, informal entrepreneurs, and just because of the context and say, for instance, the lack of access to say technology like say internet connection or like laptops for like Zoom and online video interviews because of the travel restrictions and the risk involved with COVID. I had to switch from my initial plan of using participant observations and now transitioning to use telephone interviews. So I've already begun doing telephone interviews. So far it's going well, but I
Mm-hmm.
just keep questioning myself and wondering, like, will it give me enough depth? Will I get the richness that I want? Will I get the outcomes that would be sufficient to say, okay, now I've made enough contribution to knowledge and now I can actually earn a PhD?
Yes. I mean, there's no reason why you can't use telephone interviews and get in-depth information from them. And also given the context of this is really all you can do because of problems with technology, internet connection, all that. It's certainly very different from participant observation. I mean, there's no doubt about that. But I think you can still get quite in-depth, as you're saying, that it's been going well, interviews. I mean, there's something about the telephones against your ear, and there's something actually quite um, close. You can kind of feel close to someone when it's just voice to voice. I don't know. I've experienced it. So it can actually work quite well. I think it's just down to your skills in interviewing them and listening to them and getting the most out of them, you know. But you say it's been going well.
Yeah,
I mean, and also there's also, you know, possibilities to go back to them. I don't know whether you've built that in. Um,
yeah, definitely.
yeah. But I think it's obviously, you know, basically you might have to rewrite the scope of what you're trying to do because yeah, it's very different from the range of kind of data you get from participant observation. Um, but there's no reason why you couldn't get a PhD out of this.
All right. Thank you. Appreciate it.
Okay, thank you.
Thank you. So here's a question from Olivia. Do you think that early career researchers, particularly students who have not yet decided on a research methodology, will choose research questions that allow for online qualitative methods or quantitative methods due to logistically based restrictions and constraints?
Right. So you think that they would instead of they would move from trying to do a qualitative study to try to do a quantitative study um, because that might be easier to do under these conditions. I don't think it's necessarily easier to do. I think it's the same issue. Um, I think it's hard to do participant observation online, um, but I mean, I think that's something that we'll have to see is um, whether people will feel that in order to finish in time, as you say, that yeah, quantitative methods is might be a quicker way of doing it. But the whole thing is based on what your research questions are. So whether people will be more, I don't know. I mean that I don't have any information on, because the PhD students who were both in the survey, who I talked to, and I have to say in the survey, it was mostly open-ended questions because I wanted to get depth, and I did get depth from those open-ended questions. They had already started, so obviously I didn't get anyone who was at the point of not having decided what their research questions was. So I don't have any data on that. But yeah, it is an interesting question whether it will steer some people away from doing having a question that would mean they'd have to use qualitative research.
And I unmuted Olivia, so I don't know if Olivia, if you wanted to add anything. No, okay.
Okay, that's fine. But
Could
thank you.
you,
Yeah.
sorry, Evelyn's asking, can you comment on the importance of ethics approval when shifting methodologies from in-person to online?
Yes. So yes. So several people that I talked to and also in the survey had to go through that process. And in fact, Nicole Corley, who is our QSR, we run a early career researcher grant, and she was our first winner. And yeah, she was awarded it in March, just as the pandemic came, and she was going to do basically these small groups of women making collages about their experiences of being a Black mother. And so I have firsthand experience of her having to shift that, first thinking that she could do the whole thing online. Um, and she experimented with that, wasn't so satisfactory, but she's found a hybrid method of sending them materials so they could do their collage on their own and then meet on Zoom to have a discussion of the collages they made and what motherhood means to them from the collages. And she had to go through ethics approval. And actually the ethics were, yeah, she didn't really have any issues with them. They've accepted it. Uh, yeah, I mean, she had already had the ethics approval before for the original way she wanted to do it, but they were quite open that yeah, she had to make changes, and so she's had to make it twice, go to ethics the first time, and then she realized that it wasn't satisfactory doing the whole thing on Zoom for several hours. Um, with a couple of women, and so then she has this hybrid method, which she's now adopting, and had to go second times, but they passed that pretty quickly. So I don't know if anyone else had this experience of having to go through ethics to make a change. I mean, if anyone has, maybe they could raise their hand, and just to hear about their experience.
And Evelyn, I did unmute you. You'd have to unmute yourself if you want to talk. And
Oh, there's someone's I see the hand.
okay.
Yolanda
Oh yeah.
has
Okay.
raised
I'll
her hand.
mute. Yep. Go ahead, Yolanda.
Can you hear me?
Yes,
Yes.
we can.
Hi, I am a doctoral student. I'm in an actually executive EDD program that combines research and practice, but we're in the midst of like getting ready to defend our proposal. Then we'll do our study in the summer. Did you find in any of your experiences whether victims that have been traumatized have problems with the online methods? I am doing my research on the sexual assault of Black women on college campuses. And so I was wondering if that's different, or would you think based on your experiences, it could be different with an online method, given the trauma that those individuals have experienced?
Yeah, I mean, what's interesting, there were a number of people who talked about this. I mean, different types of vulnerable groups. And what's interesting is that for me, that's an example where the telephone interview seemed to be working well. Um, that they seem freer to be able to talk. I don't know, it's sort of a closer relationship. There was someone was making that. I mean, someone else made a point about, well, this is a bit different because her specialty was criminology, and I mean, that the sort of people she was would be interviewing were very suspicious of technology, so something like Zoom wouldn't work. The thing with using Zoom, I mean, some people did use Zoom and gave people the option to share their screen or not. Um, um, but yeah, it's interesting that it seems that the telephone was sort of like the best way, that just from the people I talked to. I don't know. I don't know what you're planning on doing yourself.
Well, that's interesting that I like the ideal that you said to show your face or not show your face. I think that would be definitely a good thing to add on there. But I can also see, I like you also saying the telephone interview would be more of a way of connecting. So that's good. I haven't really decided exactly which ones I'm going to do, but it will definitely have to be Zoom, I would think, still in the
Yeah,
summer.
yeah. I mean, I think it's just basically try it out at first to see how it works. But certainly, yeah, the option, you know, you don't need to share the screen. That's fine. I think that's an important option to give people. And some people want to share the screen, you know, so I think leave it up to them. Yeah.
Great.
Thank
Thanks.
you.
Here's
Thank you.
we have a lot of questions, but here's one from Kate, or it's a question, but I thought it was sort of interesting. Is there a risk that research carried out in the pandemic and adapted or shifted within the constraints of the pandemic, digital methods adopted from face to face will be seen as obsolete, like a blip after the pandemic?
Oh, right. Sorry, can you just say that again, Stacy? I didn't quite
Yeah, so
catch.
basically like a risk that during this time people are using digital methods instead of face to face, but people, I guess, will they be seen as obsolete, like a blip after the pandemic?
After the pandemic. Yeah,
Yeah.
well, that's sort of my question.
I know,
Um,
I'm going
is
find
is
Kate and unmute.
Yeah, I mean, I think what's interesting is that, yeah, there were sort of like two types of reaction thinking about this. Um, and one person that I interviewed gave very interesting. She thought, like, if the pandemic lasts like a short period of time, that's what she thought. It would go back, um, and to the way we traditionally do things, and, like, people might um, get told if they wanted to use online. It's like, get with it. We've moved on from it. But she thought if the pandemic lasted for longer, um, that it would be, well, it would have to be incorporated more. So that was, yeah, that was an interesting interview I had. That that's how she felt. It depended on the length of the pandemic. So, like, here, I'm in the UK. We're in our third lockdown, and it's very serious. The death rates here are higher than they were in April and May. And even though we have the vaccine, you know, so it was interesting, dependent on the length. So I don't know if you want to talk.
So yeah, Kate, you're unmuted, so if you unmute yourself, you can talk, but some people are having issues with the program doing that, so.
Can you hear me? I'm
Yes.
unmuted.
Yes.
Oh, lovely. Thank you. Yeah, I'm also in the UK, so third lockdown alongside you, and understanding what that means for kind of longevity of being in lockdown. My work at the University of Huddersfield, I'm a senior research fellow, is around participation and children. And so mostly we would have met face to face. This work previous would have definitely been face to face, trust building, relationship building, very practical, very creative, and adapting those tools to online has been relatively successful. I ran a session, an art session this afternoon. It's okay. And I'm writing and learning a lot. But I feel as if when I start publishing and also theorizing on this, that in some ways it might be seen that the pandemic itself is the blip, not necessarily the adaptation of the methods, because we may be able to find arguments for other ways of using those and how we've extended and developed the models, but particularly around participation. So when it comes to the pandemic and social isolation and distancing, let's say, when we come out of this, are we hoping to therefore not be practicing in the way we are in pandemic? So there's a kind of contradiction in it for me as well. So I realize it probably is your question as well. Is it just a blip? Yeah, and does it make anything that we publish at this time as well, or we're trying to contribute to, be seen in a particular time frame?
Yeah, I mean, I think that that is a very important point, is whether, you know, a few years down the line, material that's published now is seen, well, it was done in an extraordinary period. So how does that reflect on, you know, what we can learn from it now when we're out of that extraordinary period? But I don't know, I think sometimes research in extreme settings, kind of, I mean, in general, so not just pandemics, just kind of, I'm just thinking out loud here, can actually reveal stuff that would be hidden, that would be relevant. I don't know is the answer, but I think it's a very important question, and I think the way to think of it is to then contrast, you know, what goes on in an extreme situation, which we're in now, to what happens in the sort of normal situation, or the post-pandemic. But what it can reveal might actually be worth quite a lot, as opposed to be considered, well, it's redundant. It bears no relation to life now. I think it's sort of searching for those sort of insights in what you get now.
Thank you. I mean, I also do work with people seeking asylum, and many of them have lived in conditions that we are now experiencing here, or I am in the UK, around the world, in refugee camps or in, you know, displaced spaces where you're highly restricted in movement or surveyed, or you've got lockdowns or restriction of access to, you know, food and choices, all sorts of things. And actually, when you consider participation, who actually drives the agenda as to how we develop our methods? And so it may be that culturally there's a shift anyway. So it's not actually per se researchers who will set the agenda in the future. So I sometimes wonder if that will actually be what comes out of this period, that those choices about, as you were mentioning earlier about telephones, say some people would choose to not be seen and would like to make a phone call. And this becomes far more possible as we address issues of data poverty and issues of different methods being experimented with at the moment, and how therefore the very culture itself is shifting, not just led by researchers.
Yes, no, great points. Thank you very much.
Yeah, and with somebody else, Siwa Lee, I unmuted you if you want to. Yep, go ahead.
Yeah, thank you very much. I don't have a question, but I just want to share a bit of my experience. I'm a lecturer and researcher at Robert Gordon University. I was going to carry out a study on family carers' experiences of support in rapid discharge from hospital to home for end-of-life care. And my study actually was, on hold because of all this pandemic going on. And so we had to, instead of doing face-to-face, now we have to do online. And the ethics actually encouraged us to do Zoom online. So we did that. But it's quite challenging in recruiting participants at this time because staff were busy, initially locked down. And now with the giving of vaccination, everyone is so busy. So these are the challenges that I face. And with interviewing family carers, especially bereavement, it's quite challenging because it's quite an emotional topic. So that are some of the challenges I experienced. Yeah.
Yeah, I mean, it's quite difficult to, I mean, some people who had their research disrupted, like it seems like your
Yeah.
research has been disrupted, um, actually in the interim, we're doing more desk research. We're sort of diverting, sort of like postponing um,
Yeah.
the empirical data that they were planning on doing, and doing more desk research or other aspects of the research that it was possible to do now in lockdown. But certainly I mean, you can't really get healthcare workers now to talk about
Yes.
anything because I mean they're overworked, they're overstretched.
Yeah.
Yeah.
Yes. Yeah. So that those are some of the challenges during the pandemic. Yes. Yeah.
Yes. Thank you.
Yeah. Thank you.
Um, so this has been a great discussion, and I just want to make sure I go over a few more things, and we can continue to take questions after. Is just that don't forget the handout in the handout section if you want to download it. People asked it. This is being recorded, and you'll get a follow-up email with the recording after. And I just wanted to go to the end and just talk about so part of one nice thing about NVivo is it can help you with whatever the data you are collecting, and so we do have ways to help with collection of data with our office integration. We have NVivo transcription, and 2 ways to purchase it. I use this, and Silvana uses it quite often, and it is very helpful, saves time. NVivo desktop, NVivo collaboration tools, and then ways to learn NVivo. And just want to remind you that we have 5 more webinars in the series, so please make sure to register for those. And if you can't make the time, we always send the recording afterwards, so which is helpful. And I do have an NVivo podcast, which has been really fun. You really hear the passion of the researchers that I interview. So please go check that out. And if you have some research you're doing that you'd like to share with me in a podcast, please reach out to me. You have my contact information in the handout. And then also, I would love for you to join the community. The idea around the community is to help researchers share and learn from each other. So we have these webinar series, the podcasts, and we also will be doing a second virtual conference in September. We're starting to organize that now. And then help you connect with people. We run NVivo research networks. We have the forum that you can connect with people. And then we also have funding opportunities where Silvana just talked about the early career research grant that we had in March, and we'll be having another one of those in the near future. So please check out the community. And I think at this point, what I'll do is if people want to ask Silvana a question, we have some great, or Silvana, did you want people to answer a question you had in the chat too?
Well, it was the sort of things I'm just interested in people's experiences.
Okay.
And what was interesting from the poll that it was sort of like the same percentage, like nearly 80%, did have their research disrupted. So yeah, so I mean, if anyone wants to share experiences or ask me a question.
Yep. If you want to raise your hand, I can unmute you. I mean, there's tons of questions you can also answer that people are. Okay, Barbara. Barbara, I'll unmute you. Hold on. Let me just get to your name. Go ahead, Barbara. You'll just have to unmute yourself for us to hear you.
Hi, hello. I'm a second year full-time postgraduate student in Scotland, studying with the Open University, and I had to shift everything online last year. So I was looking at the translation process of a literary translator, but in some ways the pandemic was actually beneficial for me because I care for my daughter who has disabilities. And so prior to the pandemic, thinking about the research design, I thought I will need to physically go to England where the translator is based and also arrange replacement care. So I think one thing that's come out of this is it's maybe highlighting that not all researchers can be mobile, that there are sort of barriers. And personally, I think it'd be really good if we do continue, when this is all over, to think about, researchers who are, have responsibilities, or have, even thinking here of researchers with disabilities themselves, how can we make research more friendly and more sort of open so that everyone can engage as a researcher?
Yes, that's a very important point, and in fact, there were a number of people in the survey who responded in a similar way, that actually it was much easier for them during the pandemic, not having to commute, um, uh, uh, being able to do things from home. It depended very much on your personal circumstances, I think, whether you had a home environment where you can work from home. Obviously, as you're saying, if you're caring for a child, with a disability, um, yeah, it makes it more complicated for you to go and travel and do research. Um, and yeah, I think this has shown that there are other ways of doing research that's more inclusive of people's circumstances, and being more understanding of circumstances, and certainly other. I mean, I didn't report on this in this presentation, but like people have also in the survey, um, and also in the interviews I did, was saying that working from home has actually been um, uh, much more acceptable now by employers who previously were not that flexible, but who are now seeing that it can work. So yeah, thank you.
That's great. So one thing, we do have a short survey at the end of the webinar that will pop up, and some of them are some research questions Sylvan has. So if you don't mind taking that short survey at the end too, that'd be great, because always trying to get data. So anything else, or any last words from Ali? Ali, do you want to say anything, or Sylvana?
Nothing from me. Just thank you to Silvana and for everyone else for contributing. It's really useful just to hear how research is going for everyone. So I encourage people to reach out to me if they have any questions that SAGE can help with, or just stay in touch.
Yes, and I want to thank everyone who shared their stories and asked questions here. And I think there were a few that we couldn't get round to. But yeah, I mean, I think the NVivo community, I have to say, is really one way to keep in touch with each other about research, and as a support group. And I think that is something that during this period that I mean, that people understand that others are having the same issue. So yeah, thank you very much.
Thank you. And what's great, Sylvana, people did type in their experiences, so I'll be able to share that with you in a report too.
Oh, that's great. Well, thank you everyone who's done that. Thank you.
Well, great. Well, thanks, Ali. Thanks, Sylvana. And hopefully we see some of you on our next our webinar on February 5th. So thank you very
Thanks,
much, everyone.
everyone.
Thank you. Bye-bye.
Bye.